classroom that I was in when the first tower fell.
Dana Nelson was only 14 years old on 9/11. Her school just blocks away from Ground Zero. 20 years later, she still finds it hard to talk about that day.
It was one of the most traumatic things I've ever been through.
But last December, something happened that broke her silence. She was diagnosed with an aggressive form of breast cancer.
I really want people to know that you didn't have to be on the pile. You didn't have to be digging through rubble for this to be something that's impacting your health.
The government-funded program now helps Nelson pay for her cancer treatment. Lawyer Michael Barish represents Nelson and many others like her. He calls them the forgotten victims of 9/11. Hundreds of thousands of civilians, students, office workers, residents who went back to the area when they were told the air was safe.
9/11 didn't end on 9/11. Every single day, more and more people in the 9/11 community are dying from their cancers.
After more than a decade of advocacy and medical research following 9/11, the U.S. government now recognizes the link between at least 70 kinds of cancers, as well as other illnesses, and exposure to 9/11 toxins. That link drove lawmakers to fund the World Trade Center Health Program and the Victim Compensation Fund for another 70 years.
The government let us down, and then they did the right thing. So it's just heartbreaking to know how many people haven't taken advantage of it. Less than 10% of the non-responders know about this.
Since I got sick at such a young age, I've felt so strongly about making sure that anyone who was down here or spent time down here in the aftermath of September 11th gets screened.
Nelson is determined to spread that awareness, even if it means doing something she dreads, revisiting an event that 20 years later continues to haunt her reality. Chris Reyes, CBC News, New York.